Pharmacies are playing a big role in administering COVID-19 vaccines, so we wanted to know if access to those pharmacies is fair and even-handed. What our data investigation found is another hit to an already vulnerable population. The I-Team's data analysis found fewer pharmacies on the south and west sides than in north side neighborhoods. Pharmacy deserts that could make it more difficult for tens of thousands of residents to get the COVID-19 vaccine.
It's an attack on the poor.
If we have areas that don't have pharmacies, that creates an additional barrier for receiving the vaccination.
Chicago has those barriers, according to our I-Team analysis of SafeGraph data, which compares all U.S. pharmacy locations to census demographic information. Our data team pinpointing all 395 pharmacies in Chicago. This map shows 5 areas of the city with less than 1 pharmacy per 10,000 residents. 3 of them on the south side, the 4th is on the far north side, and the 5th is O'Hare Airport.
My work found that predominantly Black and Hispanic neighborhoods in Chicago have fewer pharmacies and are more likely to be pharmacy deserts, and are also more likely to experience closures.
Pharmacy deserts are defined as communities in which residents live more than a half mile from a pharmacy and lack access to affordable transportation. It's more often an issue for the urban poor, according to researcher Dima Cotto, who estimates a third of Chicago's population is affected.
We found that a lot of pharmacies did close in the last several years that have contributed to worsening pharmacy deserts on the south and west sides.
I-Team research shows there are 254 pharmacies on the north side and 141 south of the Loop. Dr. Thomas Huggett is a family physician who has spent 25 years caring for some of Chicago's most at-risk patients on the west side.
We need to expand access to health care. We need to expand access to pharmacy services and not constrict them, especially in vulnerable neighborhoods.
There's still lack of pharmacies in relation to where people live. We have a lot of seniors, some don't drive, they have to get on the bus.
And that's what makes it difficult for struggling families that lack the ability to take public transportation because it costs a lot of money. So it becomes difficult when pharmacies are not integrated in neighborhoods the way they used to be.
Without easy access to a pharmacy, industry experts say people are less likely to take medications, and chronic conditions can become more severe and expensive to treat.
The system is so fragmented sometimes that there's so many barriers that they're experiencing that it's hard for them when they're trying to do everything right. They are trying to get their medications. They are trying to be adherent, but it's the system and how it's fragmented that's actually causing the patient to have worse outcomes.
So closures matter, they impact adherence, and they affect minority neighborhoods more than other neighborhoods, and therefore contributes to this kind of problem of disparities in our communities.
Pharmacies are going to continue to be distribution hubs for COVID-19 vaccines, making it more difficult for residents of neighborhoods with few or no pharmacies to be inoculated.
If we're going to be relying on Walgreens or CVS pharmacies, especially with very vulnerable populations on the west and the south sides, we're going to be missing a lot of people, unfortunately. So we're very concerned about the whole issue of pharmacy deserts, especially on the west side.
Community leaders tell the I-Team they would like to see more investments made in south and west side neighborhoods that would allow smaller mom and pop pharmacies to open additional locations.
Hey, if you like that video, be sure to subscribe to our ABC7 Chicago YouTube channel.